A left ventricular assist device, also referred to as an Lvad, is a treatment option for patients who suffer from advanced heart failure. This device is implanted during open heart surgery. It is possible to live a normal life with an Lvad. An Lvad pump uses batteries. It supports the left lower heart chamber by helping blood pump to the rest of the body. An Lvad is a treatment option for patients who suffer from advanced heart failure. This video is intended for nurses, patients, and family members who will be changing the exit site dressing for patients with a left ventricular assist device in the community. The nurse starts by giving the patient a mask in order to keep all respiratory secretions away from the driveline site during the dressing change. The goal of this video is to improve and standardize wound care practices by ensuring proper infection control practices while performing the dressing changes, and to show the use of an immobilization device which has shown to effectively decrease the rates of driveline infections. After watching this video, you will be able to know how to change an Lvad dressing exit site dressing, know what materials are necessary to change the dressing, be able to recognize signs and symptoms of driveline site infection, how to open sterile dressing tray, how to apply sterile gloves, how to clean driveline exit site, and how to apply the securement device to the driveline. The material you need to do the dressing: a sterile dressing kit, 1 pair of sterile gloves, 2 masks, 1 for the patient and 1 for the nurse or family member, clean gloves, normal saline 0.9% bottle, 2 chlorhexidine 2% swabs with no alcohol. If patient is allergic to chlorhexidine, use providone iodine. 1 2x2 sterile gauze, 1 no-sting barrier swab stick skin protectant, 1 driveline anchor, Centurion Foley anchor, CHG impregnated Tegaderm. The nurse disinfects her hands . The dressing should be changed once a week and as needed. The exit site should be inspected every dressing change to check for signs of infection. Warning: if you see any signs of infection, take a photo and call the heart failure clinic nurse on call. If you have a temperature over 38 degrees Celsius for 24 hours, call the on-call nurse as soon as possible. We will now perform a demonstration of a dressing change on an Lvad patient. In order to verify that it is the right patient, the nurse will ask the patient their name and birthday. Once the patient has been double identified, the nurse puts on their gloves to clean the workspace table with a disinfectant wipe. We'll now prepare all the necessary material for the dressing. Pour NS into the slot. Open the 2x2 sterile gauze. Open the DHG impregnated tegaderm. And Centurion driveline anchor. She will also open the non-sterile materials next to the sterile field. Open the chlorhexidine stick packages completely and place next to sterile field. Please note, if the patient has an intolerance to chlorhexidine, you will need to use providone iodine, which can be poured into the sterile tray. The nurse disinfects her hands The nurse will now gently remove the old dressing by pulling towards the driveline exit site. This is to reduce the risk of displacement of the driveline. The exit site should be inspected every dressing change to check for signs of infection. At this time, the nurse will assess the driveline site for any signs of infection. Encourage the patient to assess their own driveline site every time their dressing is changed. If the anchor needs to be changed, gently remove the old Centurion anchor while stabilizing the driveline. Throw it in the garbage. The patient is the best person to notice any changes each week during dressing changes. Encourage the patient to call the nurse on call from the heart failure clinic if they ever notice any signs of infection at home. Please note, at this time, if there is any old blood and/or large amounts of oozing around the driveline site, clean with NS. We will clean away any old dried blood by going in a circular motion from the driveline and move outwards, and then pat dry. It is important to clean the driveline well. If the patient has an intolerance to chlorhexidine, you will clean the driveline itself with chlorhexidine and hold it up away from the skin while it dries. It is important to not use providone iodine on the driveline itself since it can degrade the material. The nurse cleans the driveline, including the velour if exposed, starting from the exit site with the alcohol-free chlorhexidine swab stick, using a back and forth motion along the driveline for 10 centimeters. Then throw the swab stick away. Next, we will take a new swab stick and disinfect the exit site itself. Here, it is important to use back and forth friction all around. Lift the driveline to ensure that you are getting all the way underneath. Use both sides of the swab stick. Clean an area that is bigger than the dressing in a radius of approximately 10 centimeters from the insertion site. You need to wait at least 30 seconds until it is fully dry to allow for disinfectant to work, as well as to prevent skin irritation for the patient. If using povidone iodine to disinfect, clean in a circular motion with 4x4 gauze away from the exit site. Then wipe away with a dry 4x4. Since this dressing will be staying on for 7 days, we want to make sure it sticks well. For this, we will use Cavalon Skin Prep around the exit site, not on the cable itself or on the exit site. Go about a 3 centimeter radius of where the tegaderm will stick. Once you are done, allow the solution to dry for 1 minute. Dispose of Cavalon swab. Prior to applying the new dressing, the nurse must be sterile. The nurse now removes her gloves, disinfects her hands, and applies a pair of sterile gloves. In order to prevent pressure injury of the driveline pushing down on the patient's skin, we will place a folded sterile 2x2. Fold the 2x2 in half and place it under the driveline. Lastly, we will place the CHG impregnated tegaderm. The middle has a gel-type pad that has chlorhexidine gluconate in it, which acts as an antimicrobial dressing. Remove the sticky on back. When placing this, you want your driveline to be in the middle of the CHG patch, and you do not want your 2x2 to be under the patch, so you may need to adjust your 2x2 by pulling it back a little. Write the date and your initials on the dressing. We are now ready to put on our anchor. The anchor is vital to prevent excess movement of the driveline site, which can cause irritation and infections. Place it laterally to the exit site, as close as possible to the exit site right next to the dressing. Gently pull the tab through the slit to tighten the grip on the cable. You do not want to place the cable too tight, since this can cause the driveline to pull. You want to allow 2 fingers to fit underneath the cable. Troubleshooting. Never put any ointment or cream on the exit site. Avoid betadine or iodine ointments, acetone, petroleum-based ointments or gauze, alcohol solutions, and hydrogen peroxide. You have now learned how to change an Lvad driveline exit site dressing, what materials are necessary to change the dressing, be able to recognize the signs and symptoms of a driveline site infection, how to open a sterile dressing tray, how to apply sterile gloves, how to clean the driveline exit site, and how to apply the securement device to the driveline. Remember, if any signs of infection, ensure that your heart failure clinic nurse is aware. Early detection of infection can prevent hospitalization and complications. Thank you.